Welcome to this evening's webinar entitled Ask Garrison. Very simple format. We asked you to send in some questions that you might have about any of the Garrison products so that we might prepare some answers for you, get some information, more detailed clinical information for you if necessary. And boy, what a great response we had to that. Let's take just a moment, talk about what we're going to do this evening. Brief introduction. I want to talk just briefly about a couple of upcoming things that we have. And before we get to your questions, I have two questions for you this evening. So simple questions, and I'll have an email address up on there. If you've got an opinion one way or the other about these two questions, go ahead and send in an email response. It'll be a really big help for us. My name is Kevin Wahlberg, and we've been doing webinars like this, well, monthly now, haven't we, all year? So kind of a new thing for us here at Garrison. And I'm sitting here with Kendall. She helps us with all of our electronic media applications here. This evening's event is not a CE course, so we can't give you credit. But don't worry about that. We do have that coming up pretty soon, and we'll talk to you about that this evening too. Now, we'll be demonstrating on some type-it-ons this evening. At the bottom of the screen there, you see my email address. We're going to put that up a couple times tonight, so please jot it down now if you could, just in case we don't get to your question this evening or you've got some concerns or comments. We would really, truly love to hear from you. As far as upcoming events, pretty pleased to announce that next month, towards the end of the month, we're going to be doing an advanced sectional matrix technique course, and we've got Dr. Derek Draft, who is a member of our Garrison Advisory Board. Will be here with us live in studio, and we're going to go through some of the tougher cases that you face, class 2 cases, and give you some good clinical advice on that. We're going to be talking about some of those cases actually tonight too, because they were some of your common questions. So now my questions for you this evening. When you were first beginning, maybe you're just beginning with the sectional matrix system right now, or back when you first started with sectional matrix systems, would having an informal lunch and learn type webinar have been useful to you at that time? The reason I ask this is we're considering doing basically a class 2 basic sectional matrix technique lunch and learn every week for any of the new dentists or people who need a little refresher. So I'd like to know from you folks if you think that would have been helpful or still would be helpful. I'd love to hear about that, because that will really help us make the decision whether to knuckle down and start doing that. And then thanks to Kendall, she filled out all the paperwork and submitted an application for us to be able to offer CE, and that we are now accredited for that. Again, tonight's event was not prepared as a CE event. However, we're going to be working with our CE advisory board and developing some CE courses that very likely there'll be no cost to them. And we'd like to know some specifics about, preferably related to class 2s or finishing and polishing. What would you like to see in a CE accredited format? Because we definitely, again, we want to do what we can to help you guys out in your CE requirements and provide as much information as we can. We took the questions from everybody and we organized them because there were several kind of in the same category. And as you see here, I've got a whole table just chock full of good stuff here. The first category, the number one question asked was, what do I do about overhangs? Why am I getting overhangs? And if I do get them, what do I do to correct them? So, and I have a really good example here for you. This little tooth has both a gingival overhang, and then it has as you see here, this is the buccal line angle here, and it has a big buccal overhang as well, and you can see underneath here how that has got such a significant overhang. And I'll tell you what happened to cause that. Oftentimes, when you see an overhang like that, there is one of two things that have taken place, possibly both of them at the same time. The first being really aggressive wedging. The purpose of the wedge in a sectional matrix system is to seal the bottom of the box. You will get some separation with that, but it's not like when you were using a Tafelmayer style band and the wedge was your only thing that was separating the tooth. The rings of the sectional matrix system, all of the sectional matrix systems out there, they're very strong spring clips, and they drive in interproximally to provide separating force. So when you couple that with a very aggressive wedge, you can get a great deal of separation. And then if you burnish the band like you might have been used to doing with a Tafelmayer band, where you have to really stretch that metal out, if you burnish aggressively like that, you end up stretching that metal over the top of that oversized wedge, and you create that overhang on the gingiva. The other thing that happens to create the buccal and the lingual flash and overhang here that you see on this tooth is when, again, when you're burnishing very aggressively, you're pushing that band out away from these margins. This little MO, and I want to demonstrate very quickly, and I'm not going through all the steps on placement here. I'm assuming that that's kind of our beginner classes when we're talking about placement of the matrix band and stuff. So now I've wedged, I've not, you saw the amount of force I was pushing on here. I wasn't driving that wedge in really aggressively. I just, I want that bottom sealed so that I don't get any crevicular fluid leakage on the bottom, but I don't need to, separate the teeth as much, because when I apply the ring is going to do that. Now, again, in an over burnishing type situation, you see where I watch people do this at the trade shows all the time when they're playing around with a matrix system on the table, is they'll take an instrument and they'll come in here and they will push on that band and they will go back and forth as aggressively as they can, and you can see it, first of all, flattening the matrix band interproximally. You're removing the nice curvature that the band has already built in, and then you're pulling it away from the buccal and the lingual margins and potentially creating the gingival overhang as well. So what you want to do is you want to just a tugging motion, not an aggressive burnish, just so that you know that that band is in firm contact with the adjacent tooth. So now, if you, kind of similar to this, some of you may recognize this guy, the Composi-Tight Gold. This was launched back in 2002 and was our second matrix system. And these have a very aggressive burnish at the tip. And what sometimes happens with that aggressive burnish is when you put the ring in place, let's see if I can, yeah, I kind of pushed it up there. That burnish can grab the band and push in and cause a pucker by the buccal and lingual margins. So I don't know if I really achieved that with this, but it doesn't do it all the time, but certainly I've seen that happen very commonly, where I'm placing this style of ring, the aggressive burnish on the tip will grab the band, pucker it in, and create a pocket on the buccal and lingual margins. If that happens, you can sometimes come in here with, this is a band placement forceps. It's got little carbide teeth in it, so it's got a tremendous grip. You can sometimes reach in here, and if I can grab the end of that band with this, you may have to use an instrument to just distend the corner of that band a little bit, you can sometimes get in there and tug that little pucker out by just pulling on one of the ends of the bands. So that's, certainly you want to avoid that if you can. The newer rings, it's not quite an issue, but I do see it definitely. Again, the newer rings have a burnish on them. They're plastic burnish, but it is a burnish, and sometimes that will grab, or the silicone will grab the band and pucker it in. Generally, it's not all the time, but you can, like I said, grab that band and kind of tug it back out if you need to. So watch your wedging, that you're not over wedging, and then make sure that you're not over burnishing as well, or you can end up with some really nasty overhangs. So now if you have an overhang, what do you do? The interproximal finishing is a bit of a booger. It's hard to get instrumentation down in there. There was last year, wasn't it? We came out with fit strips, which are an interproximal finisher. And for like IPR, if you're doing 6-month smile or Invisalign, something like that, kind of the unique thing here is you can twist the barrel of this, and see what I did there? It just curved that, and it holds it in that curvature. So if you've got an overhang, when you're first putting the fit strip into place, make sure you have it straight, and then you want to use a single-sided fit strip. There's the double-sided has the holes in here to help get rid of excess material. The single-sided is solid like that. So you take the single-sided, and I don't know if that's really much of a contact on that one. I don't know who was messing around with the type or not. But I'm going to flip the handle around. You saw I could just take this handle off. Flip it around to the other side so that the abrasive side is towards the restoration. Have it taut. You can bring it down. In fact, this one is so tight, I'm going to use the fit strip that has the little, it has a little saw on it. It's like a Sarah saw, so somebody might have actually bonded these two teeth together. So I can take this in here, cut through that contact. This also helps to answer the question of what do I do if my contact is too tight? Well, here's one that's too tight. And again, a couple of passes with the interproximal saw. There we go. Now once it's in place, I can curve it by loosening that, and now I can finish that way down by the gingiva there with a nice curvature that'll follow the tooth, and I can lighten that contact up. And you can see the material here that was removed. Now this was the smallest, or the finest of the fit strips, very fine strip, so it just takes just a little bit off of there. Then you can snap that with some floss and see if you've lightened the contact and feel if you've removed that overhang. The next most common question was dealing with multiple tooth restorations. And these are certainly our most challenging restorations with a sectional matrix system. You end up with a tremendous amount of hardware in there. The placement of the rings between all of those matrix bands can become quite difficult. Those two cases that you see there, Dr. Leitner is a local dentist who helps us out on our advisory board. Dr. Zucker, that was a pretty nice setup that he did. You can see that he just had room enough to get all those rings in there, but that is a really hard thing to do. For the second time this year, I received a case the day of a webinar addressing what we're talking about in the webinar. The case I'm going to show you now came in today from Dr. Mike Malone, who you may know. He's on the lecture circuit and writes articles and so forth. So, so he's got a quadrant of restorations here that he's going to do, and this would be what I would consider the safe method of doing back-to-backs and multiple tooth restorations. Now again, this just came in today. I have not been able to ask him why he placed the wedges before he cut the preps. I could only guess that maybe it was to basically like ligate the rubber dam and hold the rubber dam down while he was doing that. I'm really not sure why he had those in place, but you can see we've got a whole quadrant worth of work here that we're doing. This is the safe way to set this up. He has set up a band and a wedge on each of the DOs across that quadrant. The last two teeth, he's doing an Emax, two Emax crowns on there, so he's not doing direct restorations there. But so, and the purpose of doing just the one side at a time and not using the ring is, first of all, simply for the ease of placing all of the hardware. It's just so tough to get all that stuff in there. So by having it this way, it's a very easy way to get all those bands. You're doing 3 of the restorations at one time. Pretty efficient still. And with this, you don't need, with the first side that you're doing here, the DO in this case, you're not needing to create contact. All you're needing to do is to get that side of the restoration complete, because when you do the other side, that's when you're going to create the contact. So he doesn't even need the rings here. You can see he filled the DOs and then placed the bands on the MOs and then placed the rings to get that added separation so that he could get the good tight contact between the teeth. So now he chose, in this case, he had enough room to be able to flip that one ring around, the distal ring facing the posterior of the mouth. That is a little bit tricky placement, and I'll show you that here in just a second because of the angle that the ring has on it itself. There's about a it's about a 105-degree angle. They don't come off at 90 degrees. The tines and the body of the ring are not 90 degrees. They're about 105. And that added angle in there can make that placement, that backwards placement, a little bit tricky. And plus you have to have the room to work, depending on, if the patient can't open as wide, or if you're one tooth back from where he is right there, chances are you're not going to be able to place that ring in that posterior placement. But he did it this way so that he had more access to get in there and finish the two sections. So here you see he's done the direct composites, and he's checking his occlusion and getting all of that set. He's got everything in place. He's got the crowns on there, and that's really sharp. So again, back-to-backs, multiple tooth restorations. The safest way to proceed is, just like you saw here from Dr. Malone, is selecting one set of those, either the mesial set or the distal set, doing all of those at one time, and then coming in without the ring in place, and then coming in on the opposite side, band, wedge, ring, get the nice tight contact, and you can see here he's got a really nice result. This kind of leads us right into another question about MODs and multiple band restoration. So in this scenario, when the tooth is it's not a full-size adult molar, with some of the newer bands that we have, they wrap around the tooth quite a long ways. They are quite a bit longer than, say, these are the original bands from back in 1996. Here's the molar version of that band. And you can see, let me grab one of these. Here, I'll take this purple one that we used on that first little demonstration. I'm going to flatten it out here so that you can see how much longer they are now. Yeah, so squashed flat, it's a lot longer, and it wraps around the tooth a very long ways. And on a smaller tooth, premolar, bicuspid, small molar, when you're doing an MOD, the ends of those bands can start to kind of get in the way of each other. So what I'm going to do here is I'm going to go ahead and, where did I do with it? Here it is. I'm going to pretend that our little MO here is an MOD, and you can already see what we're looking at. You can see how far that band comes around the tooth. What you want to do is kind of help it out a little bit, push it out of the way, squash it against the buccal and lingual side of the tooth. And again, we're pretending this is an MOD, and then you see how that can overlap there. Now I'm going to try to wedge this mess off here. I'm going to wedge from the lingual here on this distal because of that wide prep that we've got cut in there. That's for when we're doing examples of wide prep. So I'm going to wedge from the lingual to help support that band a little bit. And you can see here already I've run into that. I've got a little interference here. So, you know, it's just going to require some extra manipulation to get that band around there. There we go. I'm going to grab another orange wedge. And bring that in from the buccal. Okay, and again, tuck these guys in a little bit before coming in there with the ring. Try to get those out of the way. And I'm going to put the short ring on first. Of the new fusion system, blue is the shorter one and orange is the taller one, and that's what we're talking about here. Really blue for short teeth, bicuspids, premolars, pedodontic situations, the orange for taller teeth, and also they stack a little bit more conveniently one over top of the other when you're doing an MOD. So I'm going to put the blue ring on and bring the orange ring over it very carefully. Okay, so I dislodged this again just a little bit here, didn't I? You can see what what we're talking about with these rings, kind of the bands interfering with each other a little bit. I twisted that out of shape when I wedged it. That's a common problem. If you don't have the wedge, see, I did not have the wedge firmly engaged with the bottom of the band, and therefore when I went to place the ring, the band was not truly held in place. Let me get a new one here. The band was not held in place by the wedge, and that was one of the questions from later on is, you know, how do I keep that band from floating around on me when I'm placing the hardware? And that's making sure that you've got a good grip on the wedge, or on the band with the wedge down by the gingiva, and that will secure the band, preventing it from sliding around. So this should go a little better. You know, see how I had to kind of finagle that around a little bit during placement to make sure that I wasn't inadvertently grabbing the lingual side of the back band and pushing it in. It was going to push it in, so I kind of had to finagle that a little bit. That's your technical term for the day, is finagle. There will be a quiz later. Okay, there we go. So now we've got those two in place, and again, we're pretending that this was an MOD here to show the issue with the overlap of the band. Now, alternatively, it would have been, and many of you have got this in your office already, where you've got multiple systems from us or from other manufacturers. Generally speaking, if you go back to some of the older systems, you go back to one of our older systems, the bands are going to be shorter. I'm going to go ahead and pop this one in here a minute so you can see how much shorter it is when it's in place. This is the typical band that you would use. I'm using a little shorter one here. Buccal or gingival occlusal height shorter. Okay. So now here you can see if you had two of those in there, you're not as likely to have the ends interfering with each other because they're so much shorter. So, you know, if you're running into that on a regular basis, two things you can do. Take your scissors and trim the ends off of this a little bit so they don't stick out so far. You're not going to hurt anything by trimming that band. So feel free to nip the ends off of that, or if you've got some of the older bands that are a little bit shorter, you can jump into that. So there's kind of a theme of the next most common question that was asked was, what do I do about you know, I've got situations where the ring is popping off. Maybe it's a pedodontic application where you've got really short teeth. It's tougher to grip those little guys. Or you're on a first molar. You know, you're doing an MO on a first molar, and it's just there's not much of that tooth erupted. Those can be tricky. Fitting, you know, how to grip on a canine or bicuspid, and what to do if the curve of SPE is such that the hoop of the ring doesn't want to go down all the way because the curvature of the teeth at the front of the mouth are preventing the hoop of the ring from sitting down in a natural position. So we're going to take a look at those couple of topics, all related to ring placement and a secure ring placement. So I've got a little pedodontic model here. So on the pedo teeth or any really short teeth, you want to be with one of the new fusion rings, the short ring. Again, here you can see it's got the addition of the prongs at the bottom that really help to grip those shorter teeth. And then there's nothing wrong with having a few of these in your toolbox as well. I know several pedodontists who truly preferred the old gold rings because of how well they gripped on those little teeth. So placement of these is identical to any placement, but because of the aggressive tips that they have, the burnish on the tips, they do a good job of grabbing on to the tooth. And you can do that with the blue ring as well. You know, it stays on there pretty well. That's pretty tenuous right there. You just don't have on the bicuspid, the canine, you don't have any infrabulge for this to grab onto. So, you know, you've got a good grip back here. You've got very little for this ring to grab onto here, and you got to watch that it doesn't pop off. So that would be a case where I would go with I would definitely go with a gold ring, and I would take one of these, like this one's been used quite a bit, and a 3-prong plier around the back part of this ring. Just a little crimp action all the way around, a little bit at a time, not too much in any one spot or you're going to create a weak spot. That's one of the nice things about some of these old rings is you can do this to them. They were pretty good at that. So now you see how I've got those tips back again. Now you're going to get a good grip on those little short teeth. So, and the 3-prong pliers, that comes into play potentially when you're dealing with the curve of SPE. So we've got a lower here, and it's got, you know, this is a pretty ideal model, so it's not as aggressive. Sometimes this can, of course, be really curved in here, but I think it's good enough to show what our one person was asking. So they're coming in, they're placing this, and let me flip it around. And you can see on this ideal model, it's hitting. I mean, it is right tight down against that tooth, but the tine is resting in a good position. So if this were lower here and higher here, what happens is this wants to set like this, and it just on the occlusal angle here, if you tip this up, it just is not holding very well. If you were doing a DO on that one, you're not going to be holding that band as nicely up against the tooth. So now here's a little disclaimer. You didn't see this from me. Okay, so don't try this at home, but if you feel it's necessary, by all means go ahead. But a 3-prong plier, this has got about a 15-degree angle. Like the gold ring we were looking at, this was a 90-degree angle here. This is a plus 15, so we're 105 degrees right here. Well, most of the time that's enough, you know, and if you had it more than that, if you're doing an upper or, you know, like the model that we were just looking at, that's plenty for that. And if you had it any steeper, now you've got this ring sticking up in the way on all your other cases. So we're trying to, you know, split the hairs on that a little bit, and sometimes it works and sometimes it doesn't. Now you can, with that 3-prong plier, you can increase. Now you got to be really careful when you do this, because you're just asking. You can see I'm starting to bend that up a little bit, just a little bit of flex on there. And then what I would do is use maybe just increase that a degree or two to help out with that. I would put one of those little rubber bands, sterilization identifiers on here and mark that and use that ring for those cases. They're not going to come up very often, and you really got to be careful that, you know, if you grip too far down here, you're not going to do anything. If you grip too close to the plastic on the tip, you might actually, as you try to crimp, you might push the tip right off the end of that. So you got to come here on the straight part and just a tiny, tiny little bit of crimp at a time until you increase that a little bit. So that is something I will kick that over to our engineers to talk about, is maybe having maybe we'll do a purple version of this ring or something where we've increased this angle to maybe 20 degrees for those types of severe instances. Again, you know, when we're designing these, we're trying to hit a sweet spot where it's going to cover the vast majority of the restorations without creating problems with other restorations. So that's the curve of speed issue. Some basic ring placement techniques that will help also keeping the ring in place and making it easier to place them is with the new rubber tipped, either these were the ones from, we did these, what, in 2012, 2014, I think. We did the blue ones, and then this is, you know, this year's crop, the 2017 Fusion system. With these types of rings, placement of these, I'm going to tip this up here so we can see what I'm showing, is you do not want to come in and try to come straight down on your placement. What happens when you try to come straight down is you'll grab the band and you'll push the band down and crumple the band as you're trying to place the ring. So let's throw a band in there quick and show you the right way. I'm going to cheat for time constraints here and try to do this quickly with my fingers so we can get on to our next question. Alright, there is a band. There is a wedge. And you see me always putting a finger on top of the wedge when I'm placing that. If you will experience the band getting shoved right out of there if you don't. So you want to put a finger on that band as you're placing the ring. Grab the orange tall one here. So I'm going to show the occlusal view here. So if I come in straight and try to push this straight down, I'm going to catch that band and I'm going to squish it. You want to come in at an angle. Tip it up on the edge here. Come in at an angle, come into the band, and then rotate down into place. And by doing that, what I'm doing with this is I'm contacting that band in a way that is helping to hold it in position while I rotate and then descend and push down as far gingivally as the ring will go. That's a retention suggestion there, is to always make sure that you've applied a little bit of force towards the gingiva on the ring to make sure that it is seated down as far as it'll go. If you're having continual ring popping off issues, you may not be seating your ring down as far gingivally as it can go. So, you know, the patient's numb. If you go too far, and you should bottom out on the wedge in the first place. You shouldn't be able to go so far down that you're pinching dramatically on the gingiva. If you do pinch the gingiva a little bit, they're numb. They shouldn't experience any discomfort with that. So, canine and bicuspid fit. Again, there is a limit to what you can do with the sectional. They will go up between the canine and bicuspid. What you will find is less ideal of an adaptation on the canine. The bicuspid, you've got, as you can see, you've got really good adaptation here. It will grip there. You know, again, it's kind of the same situation as what we looked at with the pedo model. On that canine, what can happen is if this doesn't have a very pronounced bulge there, there's not much for that ring to grip. So you've got to, you know, eyeball that a little bit and make sure that it's going to stay seated where you're looking for. Again, this was an offshoot question of this that somebody submitted is, you know, there are times where, you know, I'm getting really great adaptation on, you know, 3 of the 4 pads, but, you know, I've got one pad that's sticking way out. Well, again, they're designed for, you know, basically the law of averages. It's going to fit the average tooth. And there will be cases where the tooth is maybe malpositioned a little bit, twisted a little bit, where you'll run into where it doesn't get as perfect of an adaptation. So we talked about the too tight a contact, what to do if it's too tight. One of the reasons you can get them too tight is, again, you know, every patient that sits down in that chair is going to be a little bit different. Some of them are going to have a little bit more mobility to their teeth, and the combination of the ring and the wedge is going to create more tooth separation, and the resulting contact is going to be tighter. So if you're infrequently experiencing too tight of a contact, I would maybe suggest that's the case, is that you're just experiencing natural variation in the mobility of the dentition. If you're having it very frequently, you're probably wedging a little bit too firmly. So maybe try backing off on your wedge size a little bit. To give you an idea, the most commonly reordered size of any of our wedge is the blue, which is the next to smallest. So watch that. Now here's a question that came in that I had to go and talk to one of our key influencer lecturing dentists about. It was a little over my head. Post-op sensitivity. You know, in the courses that I've been to, when that question's asked, about 25% of the people in the room will raise their hand and say, yeah, they run into issues with post-op sensitivity. So the current general consensus about what the cause of that is an inadequate hybrid layer that has been created, and subsequently you're getting micro leakage, and as the patient bites, they're getting some hydraulic compression in the tubules and activating those nerves. So you might take a look at what you're using for as your etching and bonding process, and maybe consider jumping up to a 7th generation product. They're a little more forgiving. They're not as technique sensitive. Something like 3M's Scotch Bond might be something that you'd want to investigate, and maybe check out a little bit of literature out there on the 7th generation bonding agents and see if that might be a way for you to go to correct that issue. So, but it's not uncommon, but certainly something that you should be able to address with a tweak to your technique. So that is a topic when one of the CE courses that we're going to be getting into later on. We'll be working with Dr. Jim Braun over from Saginaw, and we'll be talking about etching and bonding and how to prevent sensitivity. So Another tough question was, what do you do when maybe the tooth you're trying to restore isn't in full contact with the adjacent tooth to begin with, and you've got a little gap that you're trying to fill? How big of a gap can you cover with a sectional matrix system? You can go, according to the folks I talked to about that, about 2 millimeters. Nothing more than about 2 millimeters with a sectional. If it's farther than that, well, first of all, you're creating you're instigating a circumstance where you're going to have a food trap underneath there by trying to extend that so far. A way to help with one that is really wide, if you're not going to go to like a crown and correct it that way, is this is basic Toffmeyer band. It's one of our Toffmeyer style matrices, and this one, as you can see, has a very pronounced curvature. So when that is in the retainer, if you let me move this where we can see it, instead of, it's a much more pronounced funnel, okay? So the upper portion of this band reaches, this is the gingival is tight up against the tooth. This upper portion reaches over to that adjacent tooth more readily. So you might try a band like this. It's called a right curve Toffmeyer band if you're dealing with a very pronounced gap that you're trying to close. Which leads us to another tricky question. How deep is too deep to restore? Again, I spoke with Dr. Braun about this. Of course, we make sectional matrix bands that are designed to deal with what I would call slightly subgingival restorations. Your challenge with those, of course, is going to be getting a seal of this subgingival tab against that root plane. So his recommendation was, if you are looking at a case where this will extend just a millimeter and a half down subgingivally. If you're looking any deeper than that, his technique is pretty straightforward. He's going in there with a laser. He's taking that soft tissue back a little bit, and then he's restoring up to the CEJ with glass ionomer. It's just a much again, a more forgiving material for those types of tough cases. You don't have to worry as much about getting that seal, and then once you've got it built up to the CEJ, then he places the sectional matrix system as you would normally and restores the tooth the rest of the way. So I had a question about, somebody was talking about Dr. Jose Luis Ruiz is a lecturer out there, lectures on Garrison products quite frequently, and one of the things that he's talking about now is doing some of these restorations without breaking the contact for the placement of the matrix band, and there's a couple of ways to do that. The question from our write-in person was, his technique recommends the use of a fender wedge to create some separation while you're prepping the tooth so that you can get the matrix band in. And their concern was, when they attempted this, when they pulled the fender wedge out, and this is a fender wedge, okay? It's got a plastic wedge with a protecting metal shield extending from it. It's designed to prevent the burr from contacting the adjacent tooth during the preparation. So, like all of the wedges, there are different sizes. And my suggestion to the write-in person who was still unable to get the matrix band in after using a fender wedge was, perhaps you did not use a large enough fender wedge. What commonly happens is during insertion it feels tight because you're sliding the metal shield between an existing contact. So the shield is providing a lot of resistance to you. So it feels, tighter than it actually is. You don't want the shield to be what's holding that in place. You want the wedge to be holding that in place. So, I would step up a size and make sure that the wedge is engaging the teeth. down by the gingiva. It should be quite firm to insert. And that way the wedge is driving the teeth apart and not the blade. And that's if you're using a fender wedge for like a crown prep or a larger class 2, that's extremely important because you want the wedge to be what's holding it in place, because when you break the contact on a crown prep or a larger class 2 and the blade is all that's holding it in place, if you hit the blade with your burr, you could dislodge the fender wedge. So by having the wedge part firmly engaged, it's going to hold in place. And by having it wedged more firmly, you're going to create the necessary separating force to loosen those tendons, those ligaments a little bit, not tendons, ligaments, so that when you remove the fender wedge, you should hopefully have enough space then to slide the band in. Now, if you've done that and there's still not enough space, you can't get the band in, well, put a ring on there. The ring is going to start performing that same function. It's going to push on those ligaments, stretch them out. Go do a hygiene check. Come back, and that will have moved the teeth a little bit, hopefully enough for you to get that matrix band in. So you might give that a try. Sometimes wedges seem like they're too short. Well, big wide molar, and maybe the wedge isn't quite long enough to go all the way through the interproximal space. Well, the wedges are a little different. Like I've got blue ones here from a couple of our different systems. Let's see, I've got a fusion wedge right here. Okay, our longest wedge is the wedge wands, the ones with the handle on them. You can see you've got a couple millimeters of extra length. I don't think you're going to find any wedges longer than that anywhere. In fact, we had enough people complain that when we came out with the G wedge a couple years later, we trimmed a couple millimeters off the length of it. The fusion wedges are essentially identical in size to the G wedge, but they've got the little rubber fingers on them to help with sealing and with back out. And then we've got the soft wedge. This is a wooden wedge that we make, and you can see that is very long as well. Much longer than a typical, like a Premier ultra thin anatomical wood wedge is going to be. A blue is going to be, several millimeters shorter than that. All of these Garrison wedges designed specifically for use with a sectional matrix system so that you can get them all the way through the interproximal space and have them clearly visible when you're placing the ring. So if you're using a wedge wand and it's still too short, you might want to, check to see if you're working on a horse and not a human, because by golly, that's a big tooth right there. So now the yellow ones are quite a bit shorter than that. The smallest one is much smaller than that, but the blue, orange, and green are all about that length. Tips for rounding the marginal ridges. You pop a band in and take a look at, oh, there's one right here. What a lot of folks like to do when they're, I'm not going to put the distal band in here, but whether you're bulk filling using a sonic device like Curse Sonic Fill, or if you're building it up in layers, when you get to your final increment and you've got the final increment in and you've tapped that down, and maybe you've come in with like an acorn carver and you've shaped the occlusion. It's a pretty simple thing before you've cured that last layer to come in with an instrument and just reach under the edge of that band and roll that marginal ridge over. I think you'll have a better result than trying to carve that in with rotary instruments after the fact. But just again, a little blade, thin blade, come in there, roll that soft composite over a little bit, and then cure it. The new fusion rings have a little extra curvature at the top. I don't know if we can even see that on the camera here. The rubber pad on here has a different geometry than the prior. Oh, you can see that. Yeah, you can see this, the one on the right, the black plastic one, how that pad comes very straight up. And then on this one, you can see how the pad has got much more anatomy to it, so it helps to maintain the curvature towards the occlusal margin of that matrix band. So it's a little bit of a plus.